Live. Okay, fine. Thank you. So, good evening, everyone. Thanks for your patience. We had to start a few minutes late because of some technical problems. Welcome to this session of the South Asian Heritage Month, month-long celebrations. And this event called Matters of the Mind is being hosted by myself on behalf of the British Indian Psychiatric Association. I'm Ananta Dave. I'm a psychiatrist by profession. I'm a British Indian and I work currently in the NHS in the West Midlands in the Black Country Integrated Care System. I'm delighted to welcome you all from all parts of the world. Good evening to those who are in the UK and from people joining from other parts of the world. Welcome to this session, which I hope will be a stimulating and interesting conversation for you all to take part in and respond to. So I'm very excited to be welcoming our panel of guests today. Now, they come from their origins, their family origins, although some of them have come from outside the UK as adults and some of them have grown up in the UK. Their origins lie in South Asia from their families. Although not all countries of South Asia are represented today, for the ease of having a small group for discussion, we've got 4 people in total, including myself and 3 panelists. However, what we hope to offer today is a glimpse into South Asian culture and people coming from that part of the world into the UK to work in the field of mental health. So what we want to share with you all today is the experiences, personal and professional journeys of those who are working or who are involved in or advocating in the field of mental health care, their views, their insights, and what it is that they would like to tell you all today. So once I've asked my 3 guests to introduce themselves, we'll have a conversation between the 4 of us for the better part of 50 minutes to an hour. And then we'll open up for the audience, for all of you joining from wherever you are, to respond, to ask questions, comment, or share any other thoughts that you may have. So welcome once again, and I hope you'll find it interesting. So I'm going to ask my guests to introduce themselves one by one. So if I could call upon Poppy Jaman, please, to introduce herself.
Thank you so much, Ananta, for inviting me, and to South Asian Heritage Month for putting this very important conversation on the table. I'm Poppy Jaman. I am the Chief Executive, the Global Chief Executive of an organization called the Mind Forward Alliance. And our vision is to create mentally healthy workplaces all around the world. We are a 12-year-old organization. We stemmed from the City of London. And we work mainly with large corporate brands in the financial services sector. So that's my current role. I guess just a couple of other things about me. So I was on the board of Public Health England for 2 terms for 6 years. I am currently a trustee of a charity called the Centre for Mental Health. I am British Bengali. I was born in Bangladesh and came here when I was just 18 months old. What else can I say? Yeah, I'm a mother of 4 children, and yeah, delighted and honoured. And actually, another very important thing, I haven't got one on today, but I am a massive handloom sari enthusiast. And a lot of my private life revolves around saris and making sure that they are seen. And I think, yeah, so I'll pause there.
Thank you so much, Poppy. And in fact, I do remember when I first came across you on Twitter some time ago, what arrested me was your wonderful saris. And then, of course, I came to know the person behind the saris as well. So delighted that you're able to be here with us today to share some of your stories and insights. Thank you. And now, Rajesh Mohan.
Thank you, Ananta. And for firstly, can I just say thank you for organizing this from BIPA. So I was born in India, in the southern state of Kerala, which is a very warm, hot, tropical kind of place, quite humid as well. And only recently I just felt Kerala weather in the UK, in London. So I came to the UK after having qualified as a doctor and a psychiatrist in India. I started working. Well, had already qualified and had 2 qualifications in psychiatry. And I started as a first-year trainee when I came to the UK. So I went through the entire training process. So you could say that I've had quite a lot of training. My big step was adapting to to the culture in the UK, coming here when I was 29 years old. So I still remember how hard I tried in my first year to change my accent so that I didn't sound like I was a newcomer to the UK, because I realized that people would judge you differently based on how you spoke. But I knew my subject and I was quite good at what I did. All of that was fine, but that adjusting was a huge issue. But it's been a long time since. So I did all my training, then I qualified and got experience in rehabilitation. I became the chair of the rehabilitation faculty at the Royal College. I had an opportunity to meet various people from different fields outside of mental health, allied fields, and much more recently, I've become one of the presidential leads for race and equality. I've joined the presidency
Yes.
of the
And I'm going to
largest
come to
network.
that in a
So
minute,
it's
Raj. Yeah. To
yeah,
talk a bit more about
yeah,
your
it's
work.
an absolute delight to be here.
Thank you so much.
So
Thank
thank you for
you.
having me.
Yeah. And lastly, Batika Pereira, last but not the least.
Yeah, thanks, Ananta, and thanks to BIPA for organizing this. Yeah, so my name is Batika. I'm a psychiatrist, and I work with people with intellectual disabilities, ADHD, autism, like neurodevelopmental disorders in London. I'm a British Sri Lankan. I was born there, and then I moved here a couple of years ago. Go into that later. Um, and I have special interest in research, so I do research in with regard to some of the neurodevelopmental disorders such as intellectual disability and ADHD. Delighted to be here and looking forward to the discussion.
Excellent. So I think just in these introductions itself, we've seen the variety of fields within psychiatry and mental health that you're all involved in, and the way in which you came to be involved with mental health care, and also the different parts of the world or South Asia that you've originated from. So before we get to talking about your journeys in mental health care and journeys into the UK, I just wanted to ask you, I mean, this is part of South Asian Heritage Month. We're talking about mental health and the views of people working in the area of mental health in this. So what are your views about this? I mean, clearly you all felt interested enough to take part in this session today, but why South Asian Heritage Month and why talking about mental health amongst the South Asian communities? Should we be talking about other heritage months and other communities as well? And any one of you can pick it up first, and everyone else can come in as well.
Yeah, maybe I'll start, Ananta, and then
Yes, please, Batika. Yeah.
absolutely. I think like we need a South Asian Heritage Month now more than ever, really. Because if you the men specifically today we're talking about mental health issues with regard to the South Asian community. If you really think of it, there is no level playing field for certain groups in our society, and these groups vary from one country to another, and this can be based on ethnicity, gender, sexuality, or any other characteristics. And depending on which category or which group you belong to, and if you look at all the evidence, there is high risk of mental health difficulties in certain groups. So events like this or many other events to celebrate South Asian Heritage Month over last couple of weeks has given us an opportunity to start conversations about certain matters. In this here, it's about mental health matters, and to debate those things and to create a dialogue between people. And when we do that, this debate, this discussion, what we're doing today and what has been happening over the last couple of weeks, it helps to reduce certain barriers and create a common understanding. And this also helps people to think clearly about important matters. It helps me to think clearly about important matters. It helps people to empathize with other people's experiences. Like if somebody's with an Asian, South Asian background going through various mental health difficulties, to understand that. And then this just leads to various different ways. How do we persuade others to do what is necessary to reduce some of these mental health issues that people from South Asian heritage, like South Asian background, face in this country? What we are doing today, like creating this discussion, creating this debate, is not something new. This has been going on for thousands of years. Like if you go back to the Greek days, like when the Greeks were discussing this, they come to the agora to discuss the various matters. And what the South Asian Heritage Month has given us is it has created an agora for us to discuss and debate issues related to mental health in people with people coming from South Asian background. I think that's why it's really important, and I'm privileged to be part of this discussion today.
Excellent, Batika. I mean, that's such a powerful answer, and the way you wove in history as well and talked about other cultures, really persuasive, I think. Would anyone else like to come in? Rajesh?
Maybe I'll chime in there
Yes,
and
yes, please do.
add a few points to what Batika has already suggested. So for me, when you contacted me, Ananta, and said, look, would you have a chat about this? I was, from a mental health perspective, absolutely. And then there was the through the lens of empire. And that attracted me because I just thought there's two things I want to say about these two elements. So first of all, in terms of mental health, for me, there is this, we are still around the world experiencing the pandemic. Many people are working and behaving like it's over, and it's not. In my family, 16 people died in 4 different countries. The grief and the aftermath of the lack of all the things that our friends and colleagues will be able to relate to, lack of funerals, lack of connection, lack of being able to do this, practice the spiritual elements that we would normally do, the faith-based elements that we'll normally do. All of those things mean that there is an accumulative multiple factor of stresses that are building up that actually need releasing. And one of the things that we are seeing increasingly, or I am at least seeing within the workplace community that I work with around the world, my organization is in 7 countries. Our ambition is to be in 80 countries. So we've got connections all over the world, is that we're seeing more and more people needing help, needing support. So for me, we need to take mental health out of the health system, and we need to put it on our kitchen tables, and we need to put it on our dining room tables, and we need to put it in our schools, and we need to put it in parenting conversations, and we need to put it in mother-daughter conversations so that we can heal together. Community resourcing is required, and actually that this is where the heritage and South Asian bit comes in. Our communities are incredibly resourceful. Yoga, meditation that the world is now practicing as a well-being tool, as a westernized concept, came from the hearts of Islam, Hinduism, faith-based communities that are in South Asian, rooted in South Asian cultures. We need to reignite some of those community and self-help strategies that we have got in abundance in our communities to support each other. So for me, that's one of the reasons this conversation is so important now more than ever before. The world never experienced a pandemic like this, 100 years ago, but and we are generations that are going to need to heal for years going forward. And I guess what I want to do is think about how we prevent trauma continuing. Generational trauma will continue to be passed through if we don't stop, pause, and have conversations with our children, with our mothers, with our grandparents, to do some of this reflection. And it was a problem before; it's an even bigger problem now. And then I'll just say a couple of things on empire, and then I'll stop. So for my work in mental health, I received an OBE in 2017, and it took me a long time, for a few weeks. I didn't actually tell anybody that I received this letter and whether I was going to accept it or not. And then I spoke to a number of trusted colleagues and friends and decided that I absolutely was going to accept this honor. And the reason why is because when you come from a migration family, actually, my granddad worked in the merchant navy for 20 plus years. My father then contributed to the economy of this country through his restaurant businesses. I contribute to the economy of this country through my mental health work. And actually, how many Bengali women do you see recognized? How many people in the mental health world do you see recognized? So I felt a significant responsibility to my heritage to actually accept this. But the word empire consistently grates on me. And I then get challenged by people, well, why did you accept it? And the reason why I accepted it is because I I need to have a place at the table, and you don't get a place at the table if you haven't got some of the recognition. So, but I have been running a campaign with a number of my social sector CEOs for the last 2, maybe 3 years now, where we're actually asking for the honor system to be modernized, and the word empire to be replaced with excellence, so that it fosters belonging, so that all of us that are in our sector, that are receive awards for the great work that our families and our communities have done, can actually feel really proud of this recognition. So one of the reasons for me, so anyway, I'll pause there. But I just want to say that for me, I was attracted to this event for 2 reasons, and that's both sides.
Excellent. Poppy, I'm blown away by what you've said. I mean, firstly, it just goes straight to the heart, to talk about how the pandemic has affected you, losing 16 members of family in 4 different countries. I mean, that's just so difficult to even comprehend the scale of that and how it must have affected you. So, just take a moment to absorb that, I think, all of you listening in. And secondly, what you've said about bringing the conversations out of healthcare and onto the kitchen tables and dining rooms, that's such a powerful image of what it is that we actually need to bring it into the very fabric of society, make it such a part of our everyday life. And thirdly, just to pay tribute to the amount of work you've done across the world, and so such a richly deserved OBE, and all the thoughts that generated within you around empire and talking about excellence instead, really resonated with me. And I'm sure people will pick it up in conversations later as well. So thank you for sharing those, and we'll come back to some of the work you've done, Poppy, and what it is that you would like to highlight. Raj, I'm glad to see you're back. I thought I'd lost you for a minute. So what would you like to say about the question that I raised at the beginning?
I just want to start by saying, Poppy, I'm so sorry to hear about the COVID pandemic and all the losses in your family. My condolences. Um, I was going to say something celebratory first, but you've just got me thinking about the first phase of the pandemic. And if you look around, all the doctors who were dying were Asian doctors or Black doctors, ethnic minority doctors, and we realized that all of those doctors were working in the front line of NHS services, delivering services. Yeah, and they died in the course of doing that. They were not protected. They were not heard. People were raising issues right from the beginning, but none of those things were happening. But the celebratory thing is that a big part of NHS runs because of doctors from South Asian countries. I was incredibly amazed to see the number of Indian, Pakistani, Sri Lankan, Bangladeshi, and other Asian doctors in the system. There would be about 30 or 40%. Such a vast number, and other healthcare professionals. So the healthcare system here simply would not run. But then you're seized with the idea that all of these doctors are working in the front line. Many of them are not in very senior roles, and very few are in senior leadership roles. And then you realize that there's such a gradient. You don't hear people complain so much. Somehow they do treat their job as their vocation, because there is something in it, something satisfying. And I know from how Indian families see it, being a doctor is a noble profession, it's a service, it's something amazing, you get kudos for it. And but then along with that comes the fact that you're asked to work in the front line, you're asked to work with less protection than you're entitled to, and you risk your life. But at least some people would have thought, risking your life is part of, a noble profession as well. So it's a very, very sad thing in that sense. But I do want to celebrate, all the healthcare professionals from South Asian countries. And the fact that we actually have a whole month to celebrate the heritage is such an important thing. We have this richness in this country because of what happened before, because of the centuries of colonization of different countries and people coming in. Sadly, not all of them have a good life because they're not treated equally, they're not treated well. And I'm referring to the experience of people involved in the Windrush. How the subsequent generations have been treated. They've not been treated as equals. They've not been treated fairly at all. So you actually start seeing that there is inequality and there is discrimination. And this is the other area that I'm really very serious about, because you see differences. You see differences in the way people get healthcare, people know about healthcare, people who seek out healthcare. And if you do go to your GP or doctor, you have differential kind of treatment. This is variable between two genders. It's variable between different age ranges. And one thing that really strikes me is South Asian people and their experience of dementia. They don't get assessments and treatments in a timely way. They don't get the care. And when we talk about resilience and family support, it's incredible that you have all this. But that same reason is used not for you not to get support as well. So it's such a mixed bag, and it's a bittersweet experience to be here. We do have to celebrate. We have to be seen and noticed and appreciated for the contributions that you make to NHS and healthcare. But equally, you have to fight for your rights.
Yeah. That's true. Well put, Raj. I think, when you said it's a mixed bag and a bittersweet experience, and that was going through my mind while listening to you. It's like a tale of two halves or two cities, really, where, on the one hand, we talk of people from all over the world, international health workers working in the NHS and in mental health care is indispensable as being the bedrock of the NHS. And, as you said, the South Asian diaspora contributes hugely to the international workforce. But when it comes to treatment, equitable treatment, being valued and being, respected for who they are in their full identities, it falls short. And for me as well, as you all were talking, I was thinking something like this is required, and for us to be able to take an unflinching look at both the good and the bad. We need to celebrate the rich identities, the cultural heritage, the richness of communities, the strengths and the skills that we have to offer. We also have to acknowledge that within our own communities, sometimes there are things which are stigmatized, which are not given due recognition, or where there is discrimination. And so I think it's about recognizing all aspects, but essentially when we come together, when we make use of the togetherness, the power of the collective power, and we celebrate that sense of belonging, I think good things can happen, which is why coming together as a South Asian Heritage Month event and celebrating, I think, makes sense to me. But thanks for sharing your thoughts on that. So I suppose going on, building on what you all have said, working in the field of mental health care in whatever capacity, and there's a richness amongst all of you here as to what you all have contributed and done in the UK. What are the issues that you feel as South Asian health professionals working with South Asian communities that we should be focusing on in the area of mental health? I mean, it could be from any angle, whether it is from particular conditions. Raj, you alluded to dementia. It could be about any condition or about any particular perspective, whether from race, ethnicity, gender, whatever you think needs a focus. In your view, for South Asian communities and coming from South Asian professionals like you, what are the things we should be focusing on in mental health? And this time, maybe I might start with Poppy and then go round.
Yeah, absolutely. So I think there are a number of things for me. So I believe that in order to get the services that we need. So I'm just going to start there. Look, so that, well, maybe I'll start a little bit further behind. When I was 20, I was diagnosed with postnatal depression, and soon after that diagnosis, and actually even before that, I was a troubled teenager. There was lots of issues in my early years from around gender inequality. And my story is pretty open out there, but I was forced to have a marriage when I was 17, and that led to enormous mental health difficulties, which you guys are in the medical profession, you'll recognize exactly that, the trauma related to that. But actually, when I was diagnosed, it wasn't until I was in it was postnatal depression, because that's when you a lot of contact with healthcare professionals when you're pregnant and you have a baby. But what was really challenging, and this hasn't changed, Ananta, so therapy was I accessed therapy, and actually I spent quite a lot of time trying to teach my therapist what what the cultural nuances of my experience was. So this westernized model of therapeutic interventions, which hasn't evolved in order to suit multiple communities from different backgrounds, is still a problem. We are seeing an increase in therapists from different backgrounds. And actually, one of the things that the pandemic helped was global communities around South Asian. There's a South Asian helpline sort of started, and then celebrating the some of the innovation that came out of the pandemic was globally we connected in a different way. But I think if we look at support services, we've got an enormous amount of talking therapists. You've got, but actually the NHS is, and on the flip side, the NHS's mental health workforce is depleted, and yet we're not thinking about a different way of mobilizing, connecting with the therapeutic community and actually bringing them into the system so that we have a pathway that is much more easier to access and much more robust and much more diverse. And what are the community-based interventions? And then if we were going to do workforce planning around that and match up some of the resources and the skills that we need and the languages and the culture, we'd actually do a really good process. We'd develop maps of actually where do we need to invest in terms of university courses, scholarships, and opportunities for people to get into the system to create capacity to support systems. So I'm thinking actually the healthcare system and us as South Asians need to advocate that. Like we need to speak, and it's not, I don't really believe in people doing for us. It's not that, because we're all here and very capable. But how do we actually, to your point, Ananta, like form a community and build better, and we encourage our younger people to look at mental health related work that is actually held as in just as high esteem as doctors and accountants and pharmacists. So I guess that's diversifying of our own thinking. For years, my family, still quite a lot of my family just sort of go, oh yeah, so she works in mental health, and I just describe myself as a community development worker because that's all I am. And it's amazing to be just a community development worker because you listen with your heart. I think that for me is the main thing. I think the other thing I will just say is my previous organization. So I'm the founding chief executive of Mental Health First Aid in this country.
Yes, I was going to ask you about that. I'm glad you were talking about it. Yeah.
And I took that organization from a Department of Health program, set it up as a community interest company, and in a decade it turned over 10 million and 10 million. Trained 500,000 people in this country. I helped set up the Bangladesh entity, the India entity, advised the US setup. So I was pretty, and the reason why I was so behind Mental Health First Aid is essentially over 2 days, it teaches you how to have a conversation about mental health. You're not trained to be a clinician. You're not trained to be anything beyond recognize the early warning signs and have the confidence to have a conversation, which is why it's so successful, I think. But actually, when you look at the adoption, the adaptation of that in South Asian countries around the world, in South Asian cultures around the world, it's not as much as it should be. And so we need a community approach and a community push for that kind of education program that we know works to be adopted into our communities more than they are. I mean, sometimes I go to weddings, and I went to a Pakistani friend's wedding, and I had somebody come over and said to me, "Oh, I'm a mental health first aider, and your signature was on the certificate." And it was so nice to meet you. So I love it when I meet people like that at weddings, and you think, "Oh wow, like you've met," but there's not enough of us. There's not enough of us.
No, but it's an amazing thing. I mean, you have actually started a very wide movement, but as you said, in our own communities, sometimes the acceptance of maybe a psychological way of thinking or the importance of mental health is not recognized. So the advocacy and the adaptation, the 2 points you've mentioned, so important. Batika, I just wanted to come to you. What are your thoughts? What are the issues that we should be focusing on as South Asian professionals in the area of mental health care?
Yeah, Ananta. So I'm a psychiatrist, and part of my work is, or a big part of my work is working with people with intellectual disabilities, or sometimes it's called learning disabilities, and autism and ADHD, which is the umbrella term is neurodevelopmental disorder, or people call it neuroatypical. So that's big part of the work. So I thought I'll maybe highlight the issues with regards to these conditions. So
Yes.
these conditions, like the all these intellectual learning disability, autism, ADHD, these are conditions we born with, and these conditions can have significant limitations on day-to-day function depending on how severe these conditions are. And specifically when it comes to the South Asian communities, I have seen that people find very challenging with these conditions. So to build up because to prepare for today's discussion, I had a patient early this week, and I spoke to her, and she's coming from a South Asian background. She has a diagnosis of ADHD, and she has a sister with autism, and she and a brother with learning disabilities or intellectual disabilities. So I asked her about her experience and her challenges as somebody from a South Asian background having these various neurodevelopmental disorders. So she said like one of the challenges she had was because her parents come. One of the things she said was like some of the migrant Asian families' parents, they didn't have any formal education. So when it comes to these conditions, they did not necessarily understand, or the way these conditions were explained to them, they did not understand. They really found hard to understand the diagnosis of autism or ADHD or a learning disability in their children. And she has seen that within her family and many different families. And I have seen that in my clinic when people from Asian backgrounds come to see us. This impacts, and she was discussing how it affected her, that because she had a very severe form of ADHD, and so she was masking her symptoms of ADHD, and she was talking about her sister who was masking her symptoms of autism. And so as a result, they present as having fewer symptoms. So and they struggle. And she was saying how she struggled in isolation, how she struggled on her own with these conditions. But there's this expectation, there's a cultural or social expectation that they behave in a certain way. As a result, the diagnosis, none of these diagnoses were picked up until very late in their life, when they had a voice, and when they went out and started asking questions about their difficulties. And then she was talking about how this can lead to, how this has led to various mental health difficulties, like deteriorating mental health before, and that's the point. Often these difficulties are picked up. So it's quite late on in their journey, these difficulties get picked up. So and also they were saying how unlikely or less likely for parents to seek support, understand the education system, understand the health system, understand the social care system where they can access support, and that knowledge, it can be very limited. And then and then she was telling the other thing was, she was saying the cultural stigmatization associated with diagnoses such as autism and ADHD. And she said like sharing a diagnosis can bring shame. There's a lot of shame. There can be a lot of shame attached to these diagnoses in a culture where physical health ailments are more common to talk about. But when it comes to mental health difficulties, autism, ADHD, there can be a lot of stigma attached to that. And she said, like, if she shares a diagnosis of ADHD, that can impact her standing in the community, or people may see her as somebody with issues, or people may even question her ability, may doubt her ability to make decisions and choices. So the effects, the negative effects of opening up about these diagnoses, such as autism and ADHD. So that I think that what she had gone through is not different to many other people from Asian backgrounds, and at least to some extent. And she was also saying, if she chooses to talk about a diagnosis of ADHD, or if her sister talked about diagnosis of her autism, they often get dismissed by people around her, and saying, it, like with various comments, or you seeking attention, or also the worry, if you disclose this information to your employer, that you may not necessarily go up the ladder in terms of career progression. The so this it's like, it adds a lot of layers of complexity with regards to these diagnoses, and I don't think it's any different to other mental health diagnoses as well. And then the whole attitudes about medications, and how the negative stereotyping associated with medication. So that's quite a lot about the challenges she was facing with her ADHD and autism. And similarly, the families, I see families with children who have a learning disability, and the difficulties that they go through, and the conditions like learning disabilities. There are no specific treatments. It's about how do we support the individual to get the best achieve their best potential. But the level, the understanding of these conditions can be very limited in certain families, and they go from one doctor to another seeking a cure for these conditions. So the fact that and the mental, and this leads to more mental health. Families, people get stressed
So,
about it.
Batika, what do you think can help? I mean, from as a professional who has worked in this area, what is it that you can do, and what is it that we can do as communities and as professionals?
I think it's similar to what Poppy discussed. It's about the raising awareness, reducing the stigma. We need to be very open. What we're doing today should help us. I think this discussion, this debate, will help us to come up with various solutions. The challenge is these difficulties vary from one community to another, or from one generation of Asian to another generation, or from one area to another. So this discussion will bring up very like new ideas to how to tackle this issue. But fundamentally, it comes down to raising awareness, empowering people on to if there are any certain difficulties, what kind of help would be needed, and how to access that help.
Yeah. No, very, very valid points, Patika. And as you said, what you were saying reminded me of, the clinical work that I do as a child and adolescent psychiatrist. I used to work with many looked after children and families whose children were placed in care. So I think, amongst our communities, there is a particular stigma and guilt attached to children being taken into care. Not only that, I think, attitudes amongst people working in the care sector about the parenting ability or not of children who are taken into care. So I just found it is the intersection of perhaps the ethnicity, the race, the culture, maybe even gender, and religion, sometimes all of these coming together. So I could just see the impact specifically of cultural factors on children who were taken into care. The other point I wanted to make in this regard from my experience is where religion comes into play is, for example, I'm sure it opens up a whole minefield, but the Prevent program, which was started by the government, which was supposedly about safeguarding, children and young people and preventing them from, getting radicalized. And I could just see the inherent discrimination, inequalities, assumptions. And I'm sure people who might be listening in might, identify with this, but I've had professionals, patients, and carers say to me that if it was say a 17-year-old white young person who was supposed to have carried out an act which was, thought to be terror related, they would be considered mentally ill, mad as they called it, and therefore they would be taken down the health and treatment route, the care route. Whereas if a person from uh, maybe an Asian background or somebody who was of the Muslim faith committed such an act, they would be thought of as bad in the sense that they would not be thought of as having a mental illness, but some kind of having been radicalized or wanting to commit an act of terrorism, some agency within them, and therefore taken down the criminal justice route. So I think this kind of discrimination comes up. So the same diagnosis can lead to a whole other kind of discrimination within the community. And so, what you were saying just made me think of that, Batika. So thank you for sharing those views about ADHD and autism. Before I go to Raj, Poppy, I think you shared so many things, but I just want to say, although the story of what you've gone through is out in the public domain, sharing it each time is hugely emotionally demanding. And, so I just thank you once again for talking so openly about what you've gone through. And also, not only that, what you've gone through, but what you're doing today about it, how you've come through that phase, and how you're actually working so hard in order to raise a particular level of awareness and capacity within communities to deal with this. So I just wanted to acknowledge that as well, Poppy. So, Raj, what would you like to say about this?
Oh, first thing I would like to say is the amazing work that Poppy's charity does in advocacy. It is incredible because you do need to get it out there. And that's what Martika was trying to say as well, the lack of awareness and the assumptions that people hold, the negative attitudes. So I am so grateful for the work you do and for sharing your own experience. Something that I wanted to talk about was that my particular area of work or specialism, if you want to call it, is people with severe mental illness, or particularly people with longer term severe mental illness. Like this includes schizophrenia, for example. It's still very poorly understood. When I was growing up, we had a family member with psychosis who actually lived in the big family home. The other part of the house was allocated to him. He managed his own business, but he was quite unwell. Would be talking to himself all the time, but didn't really trouble anyone. But if you didn't know him beforehand, then people would get scared of this person. The family learned to all live together, and he was well looked after. He looked after himself to some extent, and that was me growing up. And I had frequent contact. We never could have a conversation with him because he couldn't do that. He would talk mostly to himself, but he maintained himself for several years, and he died only in his 80s. I think he managed quite well. And so when I went to do psychiatry, and obviously you do a lot of learning, and one fascinating thing I learned was if people had psychosis like schizophrenia and you lived in India, you had better outcome.
Mm,
If you had psychosis and you lived in the UK, you would have a poor outcome. And this is fairly robust findings in those days. I think people have questioned it because people question everything. But it's such, and the causes for this or reasons behind this were not fully understood. And I would have thought if you found something that improves the outcome of a mental health problem, why wouldn't you research and understand it? Why wouldn't you learn from it? Because too preoccupied with symptoms and problems, but we don't think enough about the structures and the systems and the factors that make you well. And there's glorious opportunities to understand that. And one thing they did understand from finer reading of the research is that it is family support and it's community support that enables people to function better. So much as there might be stigma, there's always family around, yeah, and they allow you to not be stuck in a hospital. You'll always find, if it's a rural area, you'll always find something to do for yourself. There's a role in the family. You may have labels, but you are still cared for. And then you realize that the people that I see these days in hospital don't tend to have families looking after them. But I also know there are family members who are desperately keen, and this is across all different ethnic groups, keen to care for and look after their loved ones who have an illness. But our systems really don't facilitate the carer roles to come into hospital, for example. We have various barriers. Some of them may be legit, but some of them may not be, like information sharing or with GDPR type barriers are used not to share information with family members. So I would say, there's such richness of resource out there. Poppy, I think you referred to this. We don't tap into all of that. We cannot artificially create a family within a hospital setting. We can't, we can pay hundreds of thousands of pounds to create a support system and support workers going in. It would still not be the same. So there is a need for a rethink around those. I'm not saying withdraw support, because that's also what the current government tends to do. They withdraw support, they take things away, but they don't put things back. That investment has to be in social systems and networks. So where am I going with this? I think there's learning to be had from other cultures and how they have managed and supported and enabled things. I'm not saying not all aspects of support for people with mental health in India are great. It certainly isn't. There's a lot of stigma, and the stigma is probably much worse if you're a woman, for example. Families would be horrified if a woman in their family had mental disorder, and they would first think, oh, we can never get her married off, that kind of thing. And with men, it's a slightly different thing. They're more cocooned and protected and looked after, for example. So all of those things are important. But let's think about positive things that can happen if you bring in the richness of a culture in its entirety. So there was this is an anecdote that didn't happen. So I wanted to do a piece of research to look at if Indian families moved from India to the UK, would this protective effect stay? So we applied for a research grant to look at, the family relationships and expressed emotion of families in India compared to the same in Indian diaspora families. We want to look at an area in Southall and with English families who, didn't have any other ethnic backgrounds. Sadly, we tried very hard, but didn't get funded for this because that would have been a way of learning, the dynamics and what works. So now I've realized that we have come full circle, and some of you will know a new therapy form called open dialogue. It is literally recreating a community around you. So why destroy everything and then try and throw resources and artificially create something around? Shouldn't we be protecting what we already have? And it's just a broad question.
That's a very provocative thought, but I think it's so important. Poppy, did you want to come in?
Yeah, there was just, I mean, both Batika and Raj have said, so there's so much there, but there was just a couple of things that I wanted to pick up on what Raj was just saying, if that's okay. Raj, research, and you've nailed it on that. There's two bits to that, what you've just said that I was thinking about. One is, when we come over, like our communities in this country, like there's this whole sort of so actually, let me start with the research bit. So the research bit, there are systems that perpetuate discrimination, and our government has been very good at going, oh, well, systemic discrimination doesn't exist. And racism doesn't actually exist in this country. Anyway, they were proved wrong in a big way, and it's embarrassing that we actually put that out there in the middle of a pandemic. It's heartbreaking that happened. But putting that aside for a moment, and how that disrupts belonging and everything else that we feel already, but the systems that perpetuate discrimination, and then I think, Batika, you said it right at the beginning, where's the seniority? There's a lot of us that work in the NHS, in social care, 40% plus BAME people in Black and minority ethnic people in different parts of the system, but the glass ceiling very much exists for us. So whether it's research bodies or when you look at the research bodies that actually grant the funding that you might have been going for at universities, at whichever institute you look, who are the decision makers for those research to be granted? And so the system just feeds itself. Oh, well, actually, that's not relevant. That's not going to have a big enough impact. It's not going to have a big enough impact for whom? And so I guess for me, and that's probably why I took myself out of the civil service, because I recognized that I wasn't going to make director. I wasn't going to make CEO. I took a risk so my first career, first 7 years of my career, I worked at the Department of Health as a race equality and mental health lead. But I made that decision because actually I knew I would be able to create more agency. My gut instinct was I'd be able to create more agency for myself in my career, but also in the world if I came out of the system. And I think one of the things that I put out there to our communities is we're actually quite a wealthy community if we come together. And I don't think we need to be waiting for systems to commission research for us to actually, why is it that we're not setting up trusts and funds for research that people like Raj and Batika can put forward so that we can learn what works for schizophrenia in our communities in this country and back home? So that's one bit. And then the second bit I just want to say, Ananta, is we need to decolonize the mental health system. And what I mean by that is, what Raj said was so important here. Why is it that somebody's recovery and outcomes with schizophrenia, with a diagnosis of schizophrenia, is going to be much better in Bangladesh or in India than it is going to be here, and the evidence for that exists. But actually, as British people, we are so arrogant that we think that actually only our way is the best. And when I've done work with Bangladesh mental health, for example, I'm helping my colleagues in Bangladesh to help implement their Bangladesh strategy in small ways, not a lot, not a big thing. But what I find is that the UK and the US is looked at as the gold standard, and I have to constantly be the one in the room going, but we need to start with what we've got here, and we can take bits of this and we can take bits of that, but please don't actually put the UK NHS model on the gold standard. But what is that? And that's colonialism. That's colonialism in action. So yeah.
Yeah, no, that's true. Thanks for saying it as it is, Poppy. Absolutely. I agree with that. And I think, one of the things that strikes me is that when we think of when governments or those in power think of, say, migrant communities or different cultures, there's always a tendency to think about a deficit model, that they're lacking in something. They can't speak the same as we do. Their food is different, their clothing is different, their color is different, whatever it is. And we very often forget to look at the strengths. And Raj, as you were saying, rather than destroying something which is there as a strength, which is present, and then trying to rebuild it in an artificial way, celebrate the power of community that exists in these cultures and see how it is we can safeguard it to enable people to recover. And, in mental health care, I always say you cannot have care in the community if you do not build a community. You can't discharge people into communities and say, look, this is community care, if those communities are not there. So really important for us to, I think, have that attitude of, I always say, compassionate curiosity towards various cultures, see what it is that they can bring, what are the strengths, what are the talents they can bring, and how it is that they can help us. Raj, you wanted to come in?
Yeah, I think from actually, Poppy, you made me think, and I think it's very interesting because if you look at the number of people who get detained in hospitals in the UK, immigrant groups are much more likely to be treated against their will in the in this country. And we have much more solid data about people from Black ethnicities, Black African or Black Caribbean, but people from Asian origin are also significantly much higher to be detained in hospital. So you not only do you have a condition where this group of people should have a better outcome, it's actually gone from that to much, much worse. People needing to be detained because it is not a good outcome when people get such severe illness to come into hospital like that. And I'm not saying that the psychiatric care in India is superior or anything, but it's just the natural life course of the illness. And there is learning to be had. And this is about understanding, the social connections, but also about systems. Where do you fit in a system? So if there is discrimination anyway, and we probably know a little bit more about it than we used to, that people who experience discrimination or disadvantage on a sustained basis for a long period of time do end up developing mental health disorders. Whether you want to call it disorder or not is another matter, but they do present with all the symptoms. And there is, even some research to say that increases rates of suicide. So we have every reason to look after our population in a much more balanced and sustainable way. So yeah, Ananta, you're a camp psychiatrist. I mean, you would want more investment in early years. Sorry, my lights just switched itself off.
Okay.
Bring it
Oh,
back
yes,
on
I know the
again.
rooms at the college. Yes. Yeah,
Yeah.
absolutely, Raj. I mean, as I was saying, there are so many aspects to it. This, the health inequalities, as we say, it is for us to advocate, I think, for us to make sure that there is equitable investment, not only in services, but, looking at what all of you have said, firstly, in preventative models, starting well before people become ill, and then getting the right service, culturally sensitive service when people are ill, and then investing in research in an appropriate way. So I think there are several things to it that we need to do. Batika, I wanted to
Yeah.
ask you briefly. You mentioned at the beginning about your interest in research, and just looking at, listening to this, but I just wanted to ask you whether there was anything you wanted to say about, about this.
Yeah, no, absolutely. The one of the things I'll build up on something Poppy said earlier about, I like the term decolonizing the mental health system. I think this is what we need to do, decolonize the medical education system, decolonize the research agenda. The the when it comes to, for an example, I'm sure it's in many other areas as well. But if you look at the medical training, we still medical students. Obviously, I mean, if you're going through training, you're still shown when you discuss patients, you discuss you don't discuss specific ethnic communities, how they can present. We look at only certain communities. If you look at let's say diagnosing skin cancers, you don't see pictures of somebody with a dark skin. So you see, even in whether it's in India or Sri Lanka or Pakistan, when you look at textbook, we're looking at pictures of somebody a white skin, somebody with a white skin with a condition. So the whole system, but that's not the reality. At work, you see people coming with all these conditions from all different colors of skin. The whole decolonization of the it's people are talking about it. People are now making an effort to. But I think, this is the agenda. One of the agenda we need to take forward. And similarly with the research as well, how do we decolonize the whole research agenda and bring everyone in to the
Excellent. I mean, so many strands to pick up from, such a rich conversation. I'm conscious that it's 6 o'clock. We still do have some time, and I'm not sure whether Umran is here to tell us about who has put questions in the chat, etc. But anyway, we can go on for another 10 minutes. From having discussed about the issues in mental health and your professional views, I want to bring us back to the personal just in the last few minutes. Before I ask each of you something about what it's been like for you over the years, and on a personal level, and how you've experienced life in the UK and what it has taught you and what insights it has given you, I think for me, just a moment to reflect on the continuing devastation caused by the pandemic. As Poppy said, it's not gone away. And throughout the last 2.5 years, we've seen the effect it has had on various diverse communities. And people from the South Asian diaspora have lost countless numbers of people disproportionately to the local population and the white population. Black families and members of Black communities have lost even more numbers of people proportionately. But the devastation has been immense, both in terms of professionals lost, all health and care professionals and all frontline staff, many of whom are from the South Asian diaspora, and also people in communities and patients in hospital. So really just to, look at, think about the grief, the loss that has, it's still there within communities, and how all of us coming together collectively and reaching out to each other can make a big difference. I just wanted to share something very briefly. I mean, Poppy, I think a lot of you talked about the power of healing. And at the height of the second wave of COVID in India last year in April, we started sessions. BIPA started, British Indian Psychiatric Association started virtual sessions connecting professionals from India and connecting and to professionals in the UK. So India and the UK connecting, and we call these sessions Healing Together. And in the UK had just been through the Delta wave, and we were just coming out of it when the second wave hit India. So it was about people who had been through that loss, devastation, the high numbers of deaths and illnesses, and the hospitals being overwhelmed, etc. Then supporting people who were then going through that wave, the acute wave, just as we were coming out. And I can't tell you how powerful it was for people to connect across the globe like that, support each other, acknowledge the scale and the emotions of what people were going through. And recently somebody asked me whether those sessions were still continuing. We stopped those sessions after the acute wave in India subsided. But what that person said is, why can't we still continue that? So I just feel, listening to these conversations, maybe we don't have to restrict ourselves to the UK alone, but reaching out to our countries of origin or the South Asian diaspora, bringing people together and looking at collective solutions, collective healing, collective support might be something that we all want to think about as we go forwards. Just, for all of you listening in as well, just, acknowledging what it is that you all must have gone through and are still going through the pandemic. So, coming to the personal part of it, I just wanted to ask all of you. I mean, Poppy, you came to this country when you were very young. Raj and Batika, as adults, I came here as an adult as well. Uh, Away from your professional work and all the things that you're trying to do professionally, what is it that it has been like? You've been in this country so many years now, and what are the things that you reflect on then and now, and how have we come how have you moved on as a South Asian diaspora? What has changed, and what would you like to see going forwards in the future as South Asian communities? Just sharing some of your personal
Yeah.
journeys and
I,
insights.
can I say something?
Yes.
Well, I mean, after having the transition from one culture when you have never lived in the West to UK. I mean, I started saying that earlier because it's kind of a big deal. It was a massive one because I regretted leaving everything behind. All my because I was an adult, I had life and friends and networks and everything. And why would you give all that away? I was seeking, professional satisfaction and whatnot. And then I wasn't also treated very well, so it didn't really work. It wasn't a good combination. But then years passed by, and I realized that I'm in a very unique position of having experienced and grown up and learned so much about, you know, one culture. And I actually lived in different parts of South India and learned different languages at different stages of my life. So I have all that, and I haven't lost all of them. I
How
still have a
many
couple.
languages do you speak, Raj?
My language is Malayalam, which is spoken in Kerala in the south, and I worked in a state called Tamil Nadu, and I learned Tamil, so I can get by. And Hindi is taught in school, so I could speak some Hindi, and all of Bollywood movies taught me more and more Hindi because you have to, and it's because these are all different languages, but they have some commonalities as well. Then I also learned a little bit of a language called Kannada because I was training in psychiatry in that area, and you have to learn that to take history. So it's all great. Um,
You're a
then
linguist.
too many, and then you don't hang on to them because you're not using them. So Tamil I can still speak a little bit, and my own language obviously I have. But you have that, and that's something the people around you don't have, and the immersive experience of having grown up and your values, the kind of experiences you've had as a young person growing up, as a child, as an adult, the great examples that you see around you, and you carry them all with you. So you have all that, and that's always like an edge. You have more things that you
Yeah.
can tap into, especially when you work in mental health. But forget about that. When it comes to food, for example, I feel like I know a lot about food only because I've eaten lots of different food and grown up with, and I learned to cook anyway, but much later because I found that really fascinating. Similarly, for when you think about how you dress, your style and all that. Today I'm wearing a tie. I wouldn't have done that in India at all, but it's too hot for that. But then you have other things in your armory. You can
Has
dress.
your identity, has your sense or the way you identify yourself changed over the years after you've come to the country?
I have changed. I think that's the most important thing. I've certainly changed and adapted to a new system. And I was trying to drop my accent quite seriously, making a lot of effort. And afterwards, I stopped doing that.
Mm.
But now I realize that I've got lots of facets to my identity, which is great. I wouldn't want to be anything else now. It wouldn't take any parts away. So it's brought a lot into my life, having had the opportunity of living in different places and being exposed to various sets of circumstances. I suppose things that I could do without are like, for example, feeling treated a bit less than.
Right.
Like I said, when I came to the UK, I was well trained in psychiatry, but people didn't really get that because they didn't see beyond my skin color or my accent. Accent is a killer because they'll
Mm.
immediately assume things about you.
Mm.
Um, and you don't need anything. People will assume things about you because they don't know you.
Mm.
But when they make an effort to know you,
Mm.
everything changes. And I think that's the message I'm trying to say.
Yeah.
And that's true for me as well. The assumptions I make about people would be different if only I made the effort to get to know them. and and without exception, people you get to know will enrich your life.
Yeah. Excellent. Now there was a question, but I'll come back to it because I want to give a chance to Poppy and Batika to Poppy. Just just thinking about your personal journey, your sense of identity, the way you see, how you define yourself culturally. Has that changed over the years, and what are some of your reflections?
Yeah, absolutely. So again, two sides. I think first of all, I would say that what Raj was talking about was assimilation, is how I would describe it. So when I joined the workforce and started my career ladder, I was really determined to not wear a silk kameez to school, to work. And even at school, actually, I wanted to wear trousers and not long skirts and all of that. So I found it very difficult to, like, when parents insisted that I needed to wear salwar kameez or I needed to wear a scarf to school and all of those things, because I didn't want to be different. And actually, the racism that I then experienced as a result of that, children can be very cruel. It was horrible. And I would say that I actively resisted making friends with Bengali girls at school because I didn't want to hang out with the girls that had oil in their hair. I didn't want to hang out with the girls that wore silver kameezes because I didn't want to be seen to be part of that group. And yet I was head girl at school. So it's quite interesting how my identity was very much disrupted. And then that continued into the early career. Now, what I will say is that as I then grew into my own skin and as I then recognized like my own mental health journey, as I then took therapy, coaching, developed and grew into becoming a mother and a woman, I completely have flipped that around. So I mentioned earlier that saris is a big thing in my life, and it genuinely is. So I have a collection of a few hundred saris, and actually I make a real feature of it in my house. I have a sari room that is designed like it's a sari shop, and it's a real talking point.
Would love to have a peek at this room. It'll be a
You
room
need
of
to
delights, I'm sure.
you need to come round. You need to come round. And but actually it started mid-career, where every time I did a conference I would put a sari on. And when I went to receive my OBE, I put a jamdani sari on, which is a signature weave of
Yes.
Bangladesh. And the reason for me is that jamdani needed to feature in the palace, where actually the fingers and thumbs of weavers,
Wow. Amazing.
were cut off so that they couldn't produce the muslin that
Really? Okay.
there's an amazing story of the Jamdani. You should look it up. So as I've moved through, like my, when I spoke at the conference, Bank of England, and on stage I was in a sari, but I wasn't talking about diversity. I was talking about business performance and how workforce enables business performance. Mentally healthy workforce enables business performance, with governors of the Bank of England as my peers on stage. So I think for me, I've done a 360 where I've tried to disown my heritage because of racism, and then I've grown into my skin and gone, actually I am British Bengali, and it means I've got short hair, but it also means I rock up in a sari and Doc Marten boots to actually represents both. One other thing that I will say as a woman and as a parent, I gave you a plotted history of my experience as a woman from the Bengali community. I still mentor 18-year-old, 21-year-old, 30-year-old women who are having the same experiences as me, slightly different nuances, but still being encouraged to have a marriage that they don't want to be in, stay in a marriage that they don't want to be, the stigma and shame attached with us women needing to conform. And actually, what I do is plead to all the parents here, like, suicide rates amongst young people are going up. The numbers are going up. Get educated on how to have a conversation with your young people in order to foster belonging at home, around the kitchen table, so that they are not having to turn their backs on their families in order to find comfort. And actually, to Batika's point earlier, that the young people that he talked about, so they leave it so long that actually they're in such distress that recovery is almost impossible, or sometimes it's a tragic story. So For me, this is a plea to all the parents and family members here, is let's change the narrative on how we support our children, because shame is a small price to pay if you to protect the mental health
Mm,
and lives of our young people.
mm. Such an important message, Poppy, and just take, so important to take that in, and for all of us to just ponder over that for a while. Thank you for sharing that. Very powerful. Batika, what are your thoughts about this?
So yeah, so I grew up in Sri Lanka. I grew up in Colombo in Sri Lanka, and I went to medical school in Sri Lanka, and that's when I moved to the UK. So in my 20s, and the whole so has the I was while you were talking, I was thinking, has my personality, how have I changed over last 20 odd years? It's a very difficult one. If you ask my friends who live in Sri Lanka, they'll say, "Oh yes, you have changed." The way I look at things, way I analyze things is slightly different to how I used to be, or some of my parallel cohorts. The I think the I had many opportunities. I have been lucky in some ways to go through some of getting some of the opportunities to develop my career in this country, and it has come to a stage where there's a lot I can offer. Like, this is a good situation where how do we support our community? How do we support different sectors of the community? Yeah, on that, I like to I probably quickly highlight the current issues in Sri Lanka, and
Yeah.
as most of you
Yes.
know, there is a political and economical crisis in Sri Lanka. People are struggling to meet, day to day. Some families, a lot struggling to earn enough money to bring, buy food for their children on day to day basis. So the people are struggling. There is no petrol, no diesel, a lot of electric power cuts. It's a massive issue, and you can see this trauma people going through, and I worry about the effects of this on their mental health. The Every sector in the country is struggling. So, if with regards to mental health, some of the essential medications people take for their severe mental health difficulties, they have run out of those things. So we have
Mm,
like the Sri Lankan, there's an association similar to BIPA. There's a Sri Lankan Psychiatric Association in the
yes.
UK. So we have got together and we have done some fundraising, and Ananta, the BIPA and the Royal College of Psychiatrists and various organizations have helped us to talk about these issues and think of different ways to support Sri Lanka. So there's a lot of work going on to see what we can do as an organization which sits outside Sri Lanka, but most of them has
Mm,
Sri Lankan origin, to do all this
mm,
support. So
mm,
the yeah. So as the going back to the first question, I think I have changed, and I think part of that. So I want to take the advantage of that change to be able to help, or to support certain vulnerable communities in this country,
mm.
and we need to be advocate for some of them, for some of them, and sometimes just being an advocate can make a huge difference in somebody's life.
Absolutely. Thanks for sharing that, Batika. And as you said, the situation in Sri Lanka is heartbreaking. And, we talk of journeys of empire, and it's all a full circle. We wouldn't be in the UK today if not for the legacy of empire. But, we're also looking at what the unequal world can do back in our countries of origin, and what it is that we can do from here for countries, back home. So I think such a connected, interconnected world, and how it all plays a part. So thank you for sharing that. And if you have a link, I think we can share it afterwards on YouTube, etc., as well, for Sri Lanka. Hearing you all speak, I was just remembering about how I felt as well, Poppy. When I first came to the country as well, I thought that I had to dress and look and speak like an English person in order to be accepted, to be taken seriously as a woman. I think it was even more important. Even now, I still get asked questions about whether I've taken my husband's permission to do something, or whether I've taken his permission to apply for a senior job, etc. So cultural stigma and paradigms run deep. But now, after all these years, I mean, I still remember wearing my first salwar kameez to a board meeting and thinking, I feel comfortable doing this. it was scary right at the beginning, but I got to a position of comfort, and people started, then talking, led to questions and talk of culture, etc. So I think we all need to start gently breaking the barriers and taking those, initial steps which can actually lead to some more change. So now I think I'm at ease. That sense of dualism will always remain. I'm half British, half Indian. I've exactly spent half my life in both countries. But I think for me, I'm more at ease now with their dual identity than I was before. Previously, I felt I had to be one or the other. And now, hopefully, I'm trying to blend both of those into something which feels more comfortable. So just wanted to share that. Now, I before we end, there are some comments or questions, etc., which I will try and pick up. Hopefully, I should be able to pick up most of them. So let me just see if I'm getting the right ones. So I think many comments about the fantastic contributions that you all have made, and the emotional stories that you all have shared. So that's being recognized. And Suf Anderson, you've said prevent was not really about discrimination. It actually put in the presuppositions of radicalization to those who had no concept of it. Absolutely, you're right. I think it went one step further, and we need to say it as it is. And somebody here, White Rock Entertainment, says, I think this question was to Raj. Being multilingual, do you feel you're more receptive to culture and learning? Raj, that's a question for you.
Yeah, thank you for asking that. I would say that having lived in different areas and learned the language and been immersed in a new culture has been eye-opening for me. It's been, it's shaped me, and I would like to think that I'm receptive to different people's cultures, experiences, expressions, much more than if I had been in one place. I would
Yeah.
like to think that. And if you haven't done it before, my recommendation: go and immerse yourself in something completely different. Challenge yourself, and then you might learn something. And so there are things that you would find very hard to change about yourself, and there are things that are easier to change.
Yeah. No, thank you for that. And Poppy, there's a comment about somebody loving your story about, you, the sari and the OBE. So keep that up. That image will stay with me as well. So we are coming to the last few minutes. I don't see any more comments. I just want to try and maybe bring this to a close and just say firstly, I mean, the almost 1.5 hours have sped by. I think I just feel sitting here, there is still so much more to talk about, and we could carry on this conversation for a long time. Hopefully, this will continue on the various social media channels that is being broadcast on. So please feel free to make some points that you couldn't make here today. Poppy, Batika, and Raj, if there are some things that you want to say, please put it in the various social media platforms. People can make comments and, I'm sure ask any further questions if they want, to continue on social media. For me, I want to say it's been, given me a lot to think about. Firstly, pride in the culture that we all collectively bring together, and the need to share it, celebrate it, talk about it to each other, talk about it to the wider community, inculcate that spirit of curiosity in others so that they want to know about our culture. I think that that's important. Secondly, being able to openly acknowledge what are the things that need to be set right as well. I mean, Poppy made reference to, whether it is about, marriages against their will, about not having access to education, about the stigma about certain conditions. So there are so many things that the gender discrimination, there's so many things in our own communities that we need to acknowledge fully in order to set right and be openly talking about it. The third thing is, do not forget the strengths and the assets we bring. Raj, you mentioned about the community, the richness of community in countries like India, Bangladesh, which helps us to have similar, if not better, outcomes for serious mental illness as we have in the UK. So in the UK, we can bring some of those strengths here and try and hold on to, safeguard, and build upon the strengths of community and family ties that bind us together and which help people in recovery. Poppy, I think all of you made the point about the importance of raising awareness, advocating, and making conversations about mental health part of everyday life, bringing it out of healthcare settings into non-stigmatizing everyday life and community settings, so that talking about it does not feel something that needs to be done in secret, something which is an added burden, or something which is shameful. It needs to be out in the open, and we need to start doing that with our young people, because it's the future generations who will need to have that ability and the knowledge and the trust in the adults, that they can cope with what the children are talking about and support them. So really important for us to be advocates and destigmatizing and then decolonizing the work. That was the other thing that came out, whether it is healthcare, whether it's research, whether it's education. We have a role to play about decolonizing. And I think I just want to end by saying, the sense of belonging, the collective power, and the togetherness is really important. I mean, I think not only of diaspora organizations like British Indian Psychiatric Association, or, the Sri Lankan Association, or the Pakistani Association, the City Mental Health Alliance, those alliances exist. Even things like Apna NHS, which has brought various people working in the NHS and care sector from a South Asian background together. There is power in that collective and fosters that sense of belonging and connectedness, which is so important for us to be able to thrive and do things that will improve the legacy for generations to come. So I just want to say that it's been a privilege to host this discussion. I want to thank you all for sharing so openly your views and your experiences. I hope the audience who have listened to or who will be listening to afterwards will have enjoyed and been stimulated by this conversation. Thanks to Umran for all the work behind the scenes, to Benita, and to everyone from South Asian Heritage Month supporting it. And, have a good rest of the evening. I think I'm going to finish 3 minutes ahead of schedule, but that's just as well. Let me just see if there are any final comments. Yes, that's right. I think we need to finish now. So thank you all, everyone. Have a good rest of the evening. And thank you once again. Bye-bye.
Thank you very much. Bye-bye.
Bye. Bye.
Bye.